Hello, and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Autism Spectrum Disorder and Public Health in Alabama. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 1 year for nurses, expiring on March 31st, 2017, and 2 years for social workers, expiring on March 31st, 2018. If you are watching this program on demand and want to receive a social work continuing education certificate, then you will need to complete the social work test and send it in along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. I'm Renee Carpenter, State Social Work Director for the Alabama Department of Public Health, and I would like to introduce our faculty presenters today. Bama Folsom Hager, Policy and Program Advisor for the Autism Society of Alabama, and Anna McConnell, State Autism Coordinator for the Alabama Department of Mental Health. Welcome.
Thank you. Thank you for having us today. I am Bama Hager. I have a 16-year-old son who has autism, and I work at the Autism Society of Alabama. I'm the Program and Policy Director at Autism Society. Thank you for having us today. This is exciting to get to come and talk about our area. We appreciate the opportunity to share it with folks in public health across the state of Alabama. The Autism Society of Alabama is an advocacy group, and we work to improve the services for persons with autism spectrum disorder and their families through education and through advocacy. We have a lot of programs that help families, and we enjoy interacting with families from Huntsville to Mobile, from Tuscaloosa to Anniston, Montgomery, and everywhere in between. The autism community is growing, as most people know. A little bit over a decade ago, about 15 years ago, the autism rate was 1 in several thousands. It was probably close to 1 in 10,000. Today, the rate is 1 in 68. The CDC comes out with that statistic each April, and so pretty soon this year we will have a new statistic. As we guess most years, that statistic will probably be even higher, and autism really is an epidemic, and it really is troublesome for our communities. The positive for that, if there is a positive, is that these families are not alone, and that families affected by autism have a really large community, and so we're very happy and very proud to advocate for those folks. The estimate we use right now is right under 50,000 or so Alabamians are probably living with autism. Because autism affects so many children, the number of folks in Alabama affected by autism, of course, is much higher because siblings are affected, parents are affected. People living with those individuals with autism, of course, are living with autism every day. So it really is an epidemic that is affecting many, many, many folks. The Autism ID card came out a little bit over a year ago. The Alabama legislature passed a law that created the Alabama Autism ID card. A group of families in North Alabama advocated to their state senator, and that's how the card was created. This is the front of the card that is on the slide. I'm going to go ahead and go to the back of the card just so that you can see it. And then I'm going to go back to the front of the card because it's just a little bit more entertaining to me. The Alabama Autism ID card was created, we thought, for teens and adults who were independent out in the community. So for teen and adult men and women and teenagers who might be driving, who might be out working, and they could use this card if they came in contact with folks in the community or if they came in contact with first responders to indicate that they have autism spectrum disorder. So we very much expected folks to use the card, while they were driving or out in the community. Then one symptom of autism that most people know about is a difficulty in communication. And so the original thought was, if somebody was, for example, pulled over by a police officer in some sort of traffic incident, they could use the card to indicate, I have autism, I'm having some difficulty communicating, and I'm letting you know that. What we found was actually very different. We found out that families were looking for these cards for young children, for safety reasons. Families were looking for these cards for people, well into adulthood. People were getting these cards for individuals that were very independent, like we expected, and people were getting these cards for folks with autism that were very involved, had a lot of symptoms, and maybe even nonverbal. So we actually saw more of an interest in the card than we even expected. As most people that would be watching know, the card can be obtained from any county health department. So we very much appreciate the interaction with the county health departments across the state. We've heard rave reviews. We've heard that folks have been treated very nicely and very kindly when they've gone in with their family member with autism to get the ID card. So we thank you all for that. There is an application that most of you all would probably know about. There's an application that can be obtained online for the card. The application can then be taken to the adult or the child's health provider. So it can be an MD, it can be a psychologist, to get the notification that the person has autism. Then they go and get the autism ID card. So anyway, it's been a great, great, great thing. A really cool part about the Alabama Autism ID card is the very first one in the country. There are currently this year in legislative sessions 4 other states that are copying us, and Autism Speaks is trying to copy the card that can be used on a national level. So very much a way that autism and Alabama were on the forefront of things, and very exciting to have the Autism ID card in Alabama. My week hardly goes by where I don't have somebody from another state calling me to get the specifics on the ID card so that they can get it going in another state. As I mentioned before, autism affects about 1 in 68 children currently. It affects more boys than girls, about 5 times more boys than girls. Researchers are trying to figure out why boys are affected more often than girls, and we just don't know yet. It continues to grow as an epidemic. It is exorbitantly expensive, and I can speak from my personal experience. The therapies for autism are tremendously expensive, and many, many, many therapies are needed. Whether a child has a great deal of symptoms, or even for those really high-functioning children that may have very few symptoms, the symptoms that go along with autism typically take a great deal of intervention, and so it can be quite costly for families. There is no specific mode of treatment for every single child that looks the same. So this slide just indicates that the treatment for one child with autism may look very different from the treatment of another child with autism. Autism has 3 main components that I'll go ahead and mention, and they are a communication component or a language component. Many children will have deficiencies or deficits, challenges in the area of communication. Secondly is social communication, social skills, having friendships, understanding social reciprocity. Kids with autism and adults with autism often have difficulties in those social arenas. And then lastly are sensory issues. So an individual with autism will typically have sensory issues that are quite debilitating. For them, sounds that may not bother you or I can be very distracting or very upsetting. Even, certain textures, they can have difficulties with any kind of sensory input. How bright a light is, the lights that are on me right now are not overly distracting. To someone with autism, it might be quite uncomfortable. So there's usually a language component, a social component, and then a sensory component with autism. Autism has been around in the 50s. However, there was not considerable development in treatment until the 80s and 90s. So it's kind of hard to believe because we all know so much about autism, or typically most folks know somebody with autism now. It's kind of hard to believe that there were just very, very, very few folks that had it as of the 1980s. 1987 is when autism went into the Diagnostic and Statistical Manual of Mental Disorders, and it currently has been revised, and we are now in the most recent revision of the DSM, and autism and high-functioning autism were placed under one umbrella. So now there is not a diagnosis of Asperger's syndrome. There's a diagnosis of autism spectrum disorder. And then high-functioning autism is under autism spectrum disorder, and autism spectrum disorder along with intellectual disability are all under the same umbrella. And that was done with the most recent DSM to facilitate communication, to allow professionals to be able to communicate more effectively about those core features that I mentioned, the social issues, the language issues, and the sensory issues. So this is a slide just talking a little bit about what I said earlier, specifically the social difficulties involved in autism spectrum disorder. Restrictive, repetitive behaviors are often a part of autism, and for many folks, they may be a little bit related to the sensory issues that these guys and girls may have. So sometimes when kids with autism are very fixed on their routine or very fixed on some particular object or some particular topic, like talking about dinosaurs or talking about U.S. presidents or talking about space or, you know, Star Wars, whatever they might like to really sort of perseverate on or focus on, many times that's just kind of a way for them to sort of create order in their world, because for somebody with autism, the world can be a little bit confusing because of the sensory input issues that I mentioned. And usually for most of these individuals, they're just trying to kind of, you know, get a grasp on things and get things kind of constrained and orderly and able to be managed. Who can diagnose autism? A PhD or PsyD, a psychologist, can diagnose autism, or an MD can diagnose autism. Having a team approach is really great. Occupational therapists, speech therapists can be very helpful in the diagnosis of autism. Often when a child is very young and they have some language delays or language issues, many times it will be a speech therapist who says to the parent, to the caregiver, you know, you might want to look into an evaluation for autism spectrum disorder. Wherever there is a Department of Public Health, or a county health department, I should say, there should be some organization in that county that's diagnosing autism. So at Autism Society of Alabama, we can point parents into the right direction on where to get diagnosed, where to get helped. But anywhere there is a county health department, there's going to be some facility in that county somewhere, or maybe an adjacent county, that will be doing a lot of the evaluations in that area. And we can help parents get to that. The therapies that are used for autism spectrum disorder are speech therapy, especially for the kids with language delay. For some kids with autism and high-functioning autism, there really doesn't look like there's a language delay. However, those guys typically always have communication issues. So if you ask a little bit more about the child's communication, if you ask the parent, they'll typically report, you know, yes, you know, he spoke fine, he developed language, things were going fine, but there's something kind of missing there. There's kind of a communication issue that sort of falls apart, maybe when he gets really frustrated or that kind of thing. So even the guys with really high-functioning autism who are communicating what looks like pretty effectively, if you dig a little deeper, typically there'll be some kind of communication issue. So speech therapy is used pretty much across the board with autism. Occupational therapy is a type of approach that can help with sensory issues, with getting through the day without being too overwhelmed by sensory input. Behavior therapy, in particular applied behavior analysis, is the approach that is used for these kids. Interestingly, in Alabama, we don't have that many behavior analysts, the professionals who conduct applied behavior analysis for these kids. And that's one thing that we're really working on at Autism Society of Alabama, and we're working in partnership with Autism Speaks to really try to introduce some legislation in Alabama or try to incorporate some sort of supports for there to be more behavior analysts in the state, because it really is needed. ABA therapy is the best practices, first line approach for the treatment of autism, and we need more behavior analysts in the state that can assist with that kind of treatment. This slide talks about the increase in prevalence, just to kind of hit home the fact that we do have quite an epidemic on our hand. We have pictures of some famous folks with autism on this slide, and then also just a slide to show that chances are most folks know somebody in their neighborhood, in their church, at their temple, in their community that have autism spectrum disorder. In our state, we have difficulties, like I just mentioned, with keeping professionals in the state that can work with our population. Most insurance does not cover the treatment of autism, and a lot of people are really, really surprised by that. And it's because the autism epidemic grew so quickly. It was really hard for professionals and for insurance companies to kind of keep up with that growth, because it was so tremendous and so fast. So something that's really kind of being corrected right now, and hopefully it will get a lot better. We are the Autism Society of Alabama. As I mentioned, we do some really cool programs, and this is just a few of the things that we do, but I would like folks in the county health departments across the state in particular, but also anybody working with our upcoming RCOs in the state to know about some of the things that we do, just so you'll know in case families are looking for any of these, have any of these needs. We do first responder trainings to teach first responders throughout the state how to interact with folks with autism. We work a great deal with keeping people with autism safe. Our kids with autism, and sometimes adults, will wander from safety fairly frequently. It happens to be a very specific component of our population, and a very troubling component for our population. So we've worked with a program in the state called Project Lifesaver, where a location device can be placed on the child's wrist or ankle, or the adult's wrist or ankle, and then that person can be located if they wander from safety. We have camps for families that are affected by autism, and those are recreational and a lot of fun, and something that we really enjoy participating in. I mentioned the Autism ID card, and that's a huge program that we have going on, and one that we have enjoyed our partnership with public health. We have an Autism Friendly campaign where we try to teach businesses to do a nice job of being sensory friendly to families that have autism throughout the state. We've gotten great response from that. We have sensory movies throughout the state. We have sensory baseball games. The Alabama ABLE Act I will talk a little bit about later, but it's one where we worked with the state of Alabama to create a 529A program for adults with autism, a program that can be used much like an education savings account for individuals that have autism, and they can use them for living needs or for education needs. We do a lot of conferences, and then we have support groups throughout the state, and so most of the counties that would be present from this webinar today, we typically will have a support group not far from wherever you're watching in the state of Alabama right now. And parents can get connected to other parents who are living with similar challenges. We work closely with the Alabama Interagency Autism Coordinating Council that Anna will talk a little bit about later. We have a respite program that will provide a little bit of respite for families, and we sort of move our program throughout the state. Right now it's in the Auburn area. We just finished up a program in Tuscaloosa, and we just do a small respite program in some geographical area of Alabama each quarter. We don't do a lot of respite, but we do what we can with our small program. We do respite programs to also highlight the need for respite. Autism caretakers are often pretty overwhelmed and pretty stressed, don't get a lot of breaks, and we do our respite program just to highlight that need, something that our state might be able to do a better job of helping caretakers of all types. And we have a large legislative day that is coming up in a little bit over a week, where we go to the State House and invite families to come in, meet their lawmakers, and spend some time at the State House. On our website, we have an online resource directories where families can get information on anything that they might need, anything from haircuts to pediatricians to whatever they might need in their area. And it's separated out by geographical parts of the state. So somebody from the Black Belt could look on here and find a resource, just like somebody from Huntsville could find a resource. Here's our support groups throughout the state, and we have a support group that's close to any RCO, of course, and close to any county health department throughout Alabama. And specifically, when I was thinking about a family going into a county health department, I just want to talk a little bit about being autism friendly, which is what this slide and I think the next one talk about, is that if you're seeing a family and they're struggling, maybe it looks like a child is what we call melting down, or sort of having, it looks like a tantrum, but the child typically really has become very, very overwhelmed with something in the environment. It may not be that the child is being oppositional or defiant. The child may be really, really, really distressed by some kind of sensory input or some kind of confusion from the environment. Anyway, if you see that going on, it's okay to approach that family. So, even families that have no diagnosis or some other diagnosis, if they're having those type issues in your county health department, typically that's probably happened to them elsewhere. They're not going to be shocked if you go up and you say, can I help you? Can I help you in some way? I've learned a little bit about kids who may have sensory problems. Is there something that I can do to assist? I think that's a really kind thing to do, and I know that all autism parents would very much appreciate that. Also, wherever you work, if you do come in contact with the public a great deal, to maybe have an idea in your mind where there might be a quiet space close to sort of your lobby area or your waiting area is not a bad idea, just in case something is really out of control or a kid's really having a hard time or an adult's having a hard time, to have a quiet space that a family might be able to go to. Speaking with individuals with autism, if it's an adult with autism, I always recommend just speaking in kind of a slow and clear tone. So when I speak to my son at home, I usually will just speak a little slower than I might to my daughter. And the way that it comes off, if you do use that approach, it just looks like you're speaking in very kind of a relaxed tone. It doesn't have to look real odd or real different. With that, I'm going to turn it over to Anna McConnell, the autism coordinator for the state of Alabama. And as I move the clicker over to her, I was also going to say that there are brochures from the Autism Society of Alabama, if I can go on screen. And we can provide these to any county health department. So we're easy to find, easy to get in touch with, and of course my contact information is on this webinar. But we can send a brochure about all of the things that I mentioned today, all the services that we provide. we can send a box of these to any of the county health departments that might like to have that in their waiting area.
And Bama, on one of your slides you mentioned fidget toys. What
Right, so
fidget toys?
the last slide, and I was wrapping up to make sure that I was getting to Anna, but on the last slide, one thing that we recommend in our Autism Friendly program, so for example, Regions Bank, we're just so very proud and thrilled. They are really working on becoming autism friendly for the whole state, which is just lovely and such a great model to the other banks in the state. But for example, this is one that we suggested to Regions and one that we're working on, where in the lobby they're going to have, or this would be, you know, kind of a bank teller area, they're going to have a fidget toy, almost like you could use a squeeze ball. It can be anything that you can hand a child or an adult, and it takes their attention sort of away from the environment and away from whatever it is that was really, really, really distressing. So an example would be a squeeze ball. An example could also be just a, you know, almost like just a piece of rubber, like almost like a rubber band that you could play with, like anything that you can put in your hand. Believe it or not, if you Google fidget toy, you get, you know, a whole list of sort of products that could be used, and many of these are very, very, very inexpensive. I would say for any county health department in particular that might be really large, you know, it might not be a bad idea to have just a box of those so that if it ever came up, you could have that, a family could have access to that. And then what we suggested to the bank, and I would probably say it for the county health department, is have something they could just keep. And then that way you're not having to worry about getting it back or, you know, cleaning it and all that stuff. So, and Anna may have other examples of good fidget toys that she's seen.
Well, thank you, Bama. As Bama said, I'm Anna McConnell. I'm the State Autism Coordinator, and I work with the Alabama Interagency Autism Coordinating Council. We just call the Autism Council for the long name. And that is made up of a group of stakeholders that their mission more so is to guide a collaborative effort to facilitate a lifelong system of care. And in doing that, there's a lot that needs to be developed as far as the system of care in Alabama, and that's where our partnerships come into play. And so we really want individuals with autism and their families to, like it says at the end, enjoy a meaningful and successful life. Whatever goals that they want, things that they need help with, whatever supports that are needed are available to them. And so we work with a lot of state agencies, individual self-advocates, other advocacy organizations. There's a whole group, I think there's 28 members total of the Autism Coordinating Council, and all of our meetings are open to the public. And so what Bama had talked about as far as this presentation were a lot of ways that you can get supports in general, and the Autism Society is great for information and referral. That's where I know a lot of service providers send, because they have so many connections to support group leaders and to private providers as well as public providers. But mostly what my part of the presentation will be is talking about some of the public opportunities for receiving services. And in Alabama, it can be tricky sometimes getting services, but these are some good ways to start. And the hope in having this presentation, I know there's a lot of slides, but the hope in this presentation is that if you work at a county health department, that you would be able to have an extra copy of this and give it to a family, because it has phone numbers, it has some of the processes for getting services from state agencies, and also has Autism Society's information. So please keep that in mind as we go through it. We won't talk about all the phone numbers, but I wanted to make sure you had access to them as well. So let's get started with education. IDEA started in 1975, and it says that every child in school must have a free and appropriate education, every child with disabilities. And so that has been the foundation for a lot of the special education classes and a lot of the opportunities that children with disabilities have had in the education system. Through Child Find is a phone number I'll show you later, but there's local education agencies that work together to provide services. And so It's birth through 21 is for child find for LEAs, but the birth to 3, we'll talk about this later, there's a lot of specifics for age and qualifications that's listed here, is early intervention, and then from 3 to 21 is the education system. And so this all falls within that. Here's the child find number that I just said. It's 2 different ones. So for early intervention, if you have a child that is birth to 2, call one number, and if they're 3 to 21, call another. The second number is with Department of Education, and that first number goes to early intervention at ADRS, Alabama Department of Rehabilitation Services. And those are great starting points. Another thing that education can provide are evaluations. So all public agencies, when they're serving children, they need to be able to evaluate and see what the issues are that a child is having, if they're having difficulty learning or having emotional. If you see something, they need to evaluate. And so this talks about some of the evaluations that are available, and depending on what services you would be eligible to receive would be based upon that evaluation. And I do want to also refer, just to mention, is that the Alabama Disabilities Advocacy Program has a great resource. It's called A Right, Not a Favor, and it's a booklet. And you can find it on their website at adap.net, ADAP, Alabama Disabilities Advocacy Program. And it has a fantastic book. I refer to it a lot. I know Autism Society does too. That talks about a lot of the processes from birth to adulthood and how to navigate the different agencies, what's the timeline to expect, what paperwork do you need, how do things get done. And so I'd really, they'll mail you a free copy of their booklet, and it's been fantastic. So just keep that in mind too. That's a great resource. If you wanted to have some available at your county health departments or as a social worker, I keep a stack just because when I get calls from families, I need to know where to send them, and that's been a great resource for me. And they talk a lot about the evaluation process. As far as early intervening services, that's before you would get your diagnosis or your evaluation, but you can still have some services prior to that to make sure that you're getting supports in the meantime. So that's especially in kindergarten through 3rd grade, and that's for additional academic and behavioral support in a regular education environment. And then special education, that's a term we're more familiar with. It's specially designed instruction at no cost to the parents, and it's individualized. It meets the needs of the individual. And so that means there's IEP meetings, Individualized Education Program, and that's parents are a member of the team, students are a member of the team, especially the older students that are there. And it's determining what services are needed, what are the needs, based on your evaluations, based on continuing services and support, what's needed. And so that's a big part of special education. There's also 504, Section 504 plans that are similar to the IEP process in special education. It's all related, but those are some other options as you go through the school system. Just a list of some of the related services that are available in education. It can be transportation, developmental, corrective, just basically support services. And this should be the list. So, like Bama said, there's a lot of things that are more difficult to get. So for children with autism, they typically will get some kind of therapies from their schools. Generally, it's speech and OT, but there's lots of other things that are available as well to be aware of when you're having IEP meetings and talking to schools. So it would be speech and language pathology, audiology, interpreting, psychological services, physical therapy, OT, therapeutic recreation, but really the early identification and assessment pieces are important, and that's prior to getting the rest of these services. You have to have an IEP in place or a Section 504 in place before you can be receiving these services. Just some more options for services. Rehab counseling, especially what we call transition, is at age 16 you start preparing for adulthood, for post-school activities, whether you're going to a college or community college, or if you're going to the workforce or something else. So that's transition, and so rehabilitation counseling generally revolves around those transition services. There's also
basic medical services, but it all can relate to school health. It all has to relate back to their education and their ability to learn and absorb what they're getting. So if they're having some emotional and social issues, that really can impact what's going on in the classroom. It can impact other students, but it mostly impacts their learning, the individual's learning, and there's so much that's needed for them to learn. So a lot of it also in your IEP can target, when we talk about transition, can target into daily living activities, basic independent skills that you would need as you become an adult. So those are things really to focus on, because I know there's lots of things to learn and absorb, and math and English and all of that, but what happens to students when they leave the school is important, and that's what the school time is preparing them for. Whether they're in special education or not, the school is preparing them for life as an adult. And so making sure that you have that in mind when you're in meetings and IEP meetings is important, and the teachers are right there with them, being able to help provide that instruction that's needed. So just more about transition services. It's the academic and functional achievement, just what I said, from school to post-school. The next department, so there was another slide earlier, 4 departments, 3 really, that focus on autism is Department of Education, Department of Rehabilitation Services, we call ADRS, and Department of Mental Health, we call DMH. There's lots of acronyms, so please feel free to look them back up if we use them. I've tried to make sure it's not too many acronyms here. But within Department of Rehab Services, there are 3 different programs. There's Early Intervention, we call EI, Children's Rehabilitation Services, CRS, and Vocational Rehabilitation, VR. That's why it's all printed in your handouts, because I know there's a lot to go through. But Early Intervention, their basic premise is they're the birth to 2. So as soon as the child turns 3, they move to another program and they're no longer eligible for early intervention. And that is a train the parent model. In Alabama, you probably would get maybe twice a month services. It depends what state, how much funding is available, what the needs of the child and family are. But it is family driven. They have an IFSP, Individual Family Service Plan. It's similar to the IEP, and they do transition from early intervention to the school system as well. So it's a great service, and a lot of kids with autism typically are identified right towards the end of when they turn 2. So that's, I would caution, as soon as there is any question of autism, go ahead and refer to early intervention. If they're under 3 years old, go ahead and refer. It's based on a 25% delay in one of their 5 developmental areas, and speech language is one of them, and that's typically where these children fall. So this talks, there's service coordinators that are there to help. Everything's a process, so it's 45 days from that first referral that they'll do an evaluation and they'll start getting services if they qualify. But also, as important, a parent can refer. You don't have to wait for your doctor and wait for a doctor's appointment. A parent can call and say, I have concerns, and they'll start this process. So a parent can trigger this. We talked about the 25% delay. And then also the Individualized Family Service Plan. It's a document. It said it's similar to the IEP. Parents have strong voice in this process. They determine goals, and that's what the meetings are based on. They come to the home. This is also a community and home-based service, and so they can come to your home, they can come to a child care center, whatever is the natural environment for the child. So that's a fantastic model that's helpful at this age especially. This just talks more about the IFSP. And it's just talking about the provider's role is to really educate and assist the family to help meet these outcomes. And it is important, this is a training model for families. It's not a direct service. So if you're talking about all the therapies that Bama had mentioned, your OT, your speech, your behavior therapy, this isn't meant to provide those. It's meant to teach the family how to incorporate those models in their everyday life. And so the next program within Department of Rehab Services is called Children's Rehabilitation Service, or CRS, and it's birth to 21. With autism, though, I do want to say that an autism diagnosis on its own will not provide eligibility for CRS. It's some of the other conditions that go along with autism that would get you qualified for this. Some speech and communication might qualify you. Seizure disorders could provide qualification for it, but you'd really have to call and get an evaluation and ask. CRS, in my mind, is always more of a medical model basis, and so, but they provide a whole list of services, and it's clinic-based, and so this is set up differently than early intervention. They can work closely with school systems because it's that birth to 21, and they provide counseling, therapy, assistive technology. And the other part of CRS is there's no income level to qualify. Whether you have private insurance that you are purchasing on your own because you're self-employed, or if you have public funds that you're getting like Medicaid, it doesn't matter. So anyway, any income level, you're able to access services. They may bill some of your insurance depending on what it is, but there's usually a sliding scale too, to make sure that services are available. This is what's saying they're asked to participate, but it's based on a sliding fee. These are basically from some of the forms that get you to CRS. So those are just there for information when you look through it. And the next service, this is one that is more used by individuals with autism. It's called Vocational Rehabilitation, or VR. And so there's a number of VR services and ADRS offices throughout the state. And Voc Rehab starts services at, with the school system at 16. So I had mentioned in Department of Ed, transition services start at 16. So you would have your IEP team of the parent, hopefully a student, teachers, any other personnel that would meet together, and a vocational rehabilitation counselor is in the area and should be attending those meetings as well. So that would help preparing and transition. Even if they were to graduate at 21, it's that preparation period. It may take that long to get ready for whatever is post-school. And this is focused primarily on employment, but they can also provide services for post-secondary education. And so this is individualized as well. That's a very important piece in any services that are provided, but especially to individuals with autism. It's called a spectrum for a reason. They're all very different, and so trying to make sure that everything is tailored and the right supports and right services for each individual. And this says every public high school in Alabama has a Voc Rehab counselor assigned to provide transition services. That's very important. So make sure when you have IEP meetings and you get to that point, ask that the Voc Rehab counselor be there if they're not already scheduled, starting at age 16. And this is a phone number. Our contact on our council is Karen Jenkins for transition services, and there's her phone number and contact information to make sure that you're connected. Some other things for transition services, Voc Rehab really does offer a lot, and sometimes it depends on the location of some other services that are available, but a lot of what is offered is assistive technology, looking at employment. What are you interested in? Doing job coaching, a lot of placement, trying to make sure they keep their job. Interviewing is often a hard thing for individuals with autism. They may have lots of academic success, lots of knowledge, but the social piece is really difficult. So imagine going to a job interview and not having the appropriate social skills. You may not even get your job, but then once you keep it, how do you interact with your coworkers and make sure that? So really Voc Rehab can help in a number of those areas, and hopefully that's been going on in the classroom as well leading up to this. So it's an important piece for employment and for life, and so making sure that individuals have these services. Just like I said, social skills training, post-employment services, guidance counseling. They do a lot of needs assessments, just testing to make sure that the information that they're working towards is correct, that they're meeting goals that have been established by the individual and the rehab counselor. and then everything else is based on need. These are some opportunities that Voc Rehab offers. I do want to point out Project Search. That is a great program that has been started, I think, over the past 3 years, I think is how long it's been in Alabama. It started with 5 sites, and now it's moved to 10 different sites in Alabama. And really what they provide is it's a partnership between Department of Mental Health, Education, and ADRS for Voc Rehab, and it's for graduating people who are graduating, who are leaving the school system. Their last year in school is an internship partnered with a local business. And so ideally it's like a hospital or a larger organization where you can have multiple opportunities for different kinds of employment. So you might work in one part of the hospital for this term, 3 months, and then move somewhere else. You could be prepping equipment and sterilizing. You could be sorting and doing the loading dock. I mean, there's lots of things, and this is a national program that really has found success. And so we're in 10 different locations. They're in multiple hospitals across the state, which is really exciting. And their employment rate is pretty high. I think it was about 70-something%. It was high, especially. And this isn't autism specific. This is across the board disabilities that are interested in employment, and they take about 10 individuals. So just something to look at. Hopefully it'll be increasing around the state, but just an example of some of the partnerships that you really can go further with, partnerships among agencies, private, public, whatever. It's going to take multiple groups to get the kinds of services that are needed provided to these individuals. And then also, summer employment is a big deal, and especially for summer classes. So if an individual is in school, maybe they could get jobs over the summer, teen transition supported employment. And this is more for adults, this section. So a lot of the eligibility, as I said, eligibility is a big deal. You have to have documentation of a developmental disability completed in the past 3 years. But for mental health and for ADRS, documentation for any service is vital, but you need documentation of a developmental disability, or for mental health purposes, an intellectual disability, before the age of 18, I think. It may be 21 for different groups, but if you're starting this process and the journey with autism, make sure you keep all of your documentation. It's really important for getting services and further down the road. You can also access online some of their information, and you can go to a local office. There's located around the state. So just different kinds of services depending on where you are, and hopefully it meets the needs of each individual. And there's 20 offices around the state: job training, orientation, job placement. This talks about eligibility. You have to have a physical or mental impairment that's a substantial impediment to employment and must be able to benefit from services in terms of going to work. And there's 2 different programs at Voc Rehab for employment. And what I've learned is that the second program, Milestones, right here, is the one that's mostly preferred for individuals with autism. But the STEPS program is not, they don't qualify for supported employment, so they don't receive the job coaching or the long-term support. So for individuals with autism, it may take longer to get the information down, to have practice, to explore your job opportunities. And so Milestones is a better fit for individuals with autism, and that's the supported employment program. Job coaching is included, and long-term support for the life of the job is included. And just sticking here with our Autism Coordinating Council, I said we work with a number of agencies, and so our Accessibility Committee chair had met with Department of Rehab, and they are working on a pilot project in the Birmingham office to have a liaison that's an autism liaison. So individuals who are calling VR looking for services who have autism would be transferred to this person, because some of the testing, just some of it needs to be tailored for autism, because the way questions are asked is important, the information that's provided is important, and so someone who really knows about autism and some of the differences to other disabilities would be great. And so in Birmingham location, they're working on a pilot, and if that's successful, and we anticipate that it will be, it'll be provided throughout the state. So we're excited about that and very thankful to ADRS and VR for that service. Moving on to the third agency that provides services in Alabama is Department of Mental Health. And there are a number of ways to reach, to get services. So I want to make sure, a lot of this is contact information, and so Region 1, you can see contact information there. That's kind of central Alabama. I'm going to go through these. I mostly just wanted you to have it on your slides. So if a family came in, they had contact information and knew who to go to. There's 5 different regions for the Regional Services Department. It's called Community Services. There we go. And so in order to look at, they do a lot of monitoring, a lot of systems information. And so I'm going to go through different ways, but I wanted you to have those frontline phone numbers. So in general, mental health, in the area of mental health, the prevalence of autism is increasing. For adults with developmental disabilities, the main way you would get services through mental health is through a waiver. It's called the Home and Community-Based Waiver. In Alabama, however, you have to have an intellectual disability to be eligible for that waiver. And so as far as developmental disabilities, it's usually, for autism specific, it's the co-occurring conditions that would get you eligibility. So just to be aware of that as you search for services, that's a big determinant of what services you would receive if you were able to receive any. There's also some limited waiver slots, so there's only a limited number of eligible individuals, and many states have issues with long waiting lists, as does Alabama. And so we need specifically trained staff in autism. I know they're getting housing and community specialists, and so hopefully that would help the autism community too as they get older. You saw the prevalence numbers increase, and so there's larger numbers of individuals who are reaching that adulthood age and needing some extra support. And so that's what the housing and community living specialists we're hoping would be able to help with over time. There's also designated 310 agencies, and that is a point of entry for the waiver applications. And there's a call number later on. And so if you're interested in applying for a home and community-based waiver, there's 2 waivers that typically individuals with autism receive. One is called the Living at Home waiver, and the other is the Intellectual Disability waiver. And you would apply for both of those the same way. You would go through the 310 agency, or you could call the call center, and it's the number at the bottom of the screen. And there's a whole application process. There's information online as well about that process. And this is just talking about the process. I won't go into all the details, but wanted you to have it available in case a family was asking. Again, documentation is important. Make sure you have it, especially for applications. These are just talking about different scoring methods that are used for their assessments. The ICAP is one. But right now, there's also assessments on how critical, so criticality scales are also used in addition to your ICAP scores and the inventory taken there. And that would determine your place in line. So if you were eligible for a waiver, there's a long waiting list, and then people who are able to access the waiver typically have more critical situations and have higher, more impressive scores on the ICAP. This is just more information. This is the criticality summary I just talked about. There's case managers who would walk you through that process and let you know. They would reevaluate to make sure that your criticality score, that your ICAP score is current. And this would all be through the 310 agency. So I apologize for going through this. It's a lot of detailed information that you just need access to more than discussion. And this is what we were saying, the funding for the waiting list is allocated by priority needs. Okay, so this is the website for the Alabama Department of Mental Health. They have information. Please call one of those phone numbers. Both will get there. The 24-hour referral line is fantastic. And so that is the basic information for state services. There's a lot of methods for getting services, and eligibility tends to be something you have to navigate carefully in Alabama. But in education, at least you work your way up. So if you were talking about an individual who was diagnosed with autism at a young age, they would need to look at early intervention services, look into CRS as well. And then once they turned 3, there's preschool services that are available through Department of Education to see if you're eligible for those. And then over time, probably about middle school, start calling Department of Mental Health if you think that that's something that you would be interested in and possibly eligible for, to do that as well. And then at age 16, start contacting Voc Rehab and moving in that direction. And so that's kind of the progression of state services in Alabama, just to have that in mind as you're in contact with other parents who've been there. That's the most important part, is to find somebody, a mentor who's been there, walk you through it. And often whenever we talk with Autism Society, they're the ones who know the most, are the parents in the area. So if you talk to someone from a small rural town, they still know how to get things done. And even the larger towns, they know the best places to go, the best way to get services. So make sure to contact Autism Society, to contact state agencies and ask questions, and to talk about the need for autism services in Alabama. It's definitely still a long ways to go in how to really access services, but hopefully this is a good start, and that you have information available for accessing services.
Okay, well at this point I think we'll take a short break. I want to remind our viewers that we do have the phone number for you to call if you have questions. We also have the email address. So if you want to go ahead and get those questions in, we'll be taking those in the second half of our program. Welcome back to our program. Again, I want to remind you, if you have questions, you may email them or call us. So now we can resume our program with Bama.
Great, thank you. Thanks again for having us. Thanks for sticking around after the break. We very much appreciate it, and we've enjoyed the opportunity to speak today. The next section that I'm going to talk a little bit about is sort of the way that families may assist their loved one with autism through childhood, through adulthood in the community. So I'm going to kind of jump around a little bit and talk a little bit about childhood sort of planning, and then also adulthood planning. And we often use the term transition or transitioning from childhood into adulthood, and the things that adulthood brings, like adult tasks of work and independent living and recreation, having friends, those type adult activities are becoming more and more important, especially as the autism population is getting older. So there's a really large group for the first time of autism young adults in our communities, and we're learning a great deal about what these folks need, whether they're living independently or living at home. About 80% of individuals at this point who are reaching adulthood and have autism are living in their childhood home or living with their parents. It appears that over time, with more resources in communities and with more services, there will be more individuals living independently. So that's our hope, and that's kind of our expectation, is that there'll be more individuals as time goes on who in adulthood live independently and aren't living in the home with their parents. There is an Alabama Family Trust, which is a great service that the state of Alabama provides, and it is a type of special needs trust that most Alabama families can qualify for and use as a trust for an individual who has a developmental disability to use in adulthood. And funds can be placed by the family members, by loved ones, into the trust. The individual with autism or somebody that oversees that trust for the individual with autism can then use those funds in the trust for education purposes, for living purposes, for whatever the individual with autism might need, and it doesn't affect that individual's qualification for Medicaid services or for state services. So that's the way that a trust is used. One of the trusts that's available to these folks, as I mentioned, is the Alabama Family Trust, and it is a state-provided trust. They do great work. They're a great organization, super friendly and very helpful. So I enjoy interacting with those folks. There's a little bit of information about the Alabama Family Trust and the Alabama Family Trust website for families who might be wanting to set up a trust for their loved one, especially to be used after those parents are deceased. A special needs trust is very similar, and it is a private trust, and a special needs attorney can set up a special needs trust for a family. It's used in the exact same way as the family trust for Alabama. A special needs trust is a trust that can be set up, a parent's life insurance dividends or anything that the individual with autism might inherit can go into the trust, and then the money can be used as needed for what the adult might need, and it does not affect their eligibility for Medicaid or their eligibility for other state services. There's a little bit of descriptive information about the Special Needs Trust and the Alabama Family Trust. The ABLE Act is a new act nationally, and it is a new state law as well. The Achieving a Better Life Experience Act was an act that was created so that families can set up a savings plan, much like a 529 college savings plan for a neurotypical child. A 529A, or an ABLE account, can be set up in much the same way, where parents or caretakers can contribute to that fund over time, just like a family would contribute to a 529. And then that money can be used in adulthood by that individual for many, many, many purposes. And the purposes that these monies can be used are a lot more diverse and a lot more liberal than the way that money can be taken out of a special needs trust. So that's kind of how the ABLE came into being. And the ABLE Act in Alabama was passed last legislative session, so it was passed in 2015. And at this time, the national ABLE standards are being set forth or decided upon. And after those are all agreed upon, then the state ABLE Acts will be in place. But anyway, it's a great thing, and it's great that our state was on board the very first year, and that our state legislature responded and got the ABLE Act ready to go in Alabama. As soon as those national standards are in place, the ABLE Act will be off the ground. And there is a contact for the ABLE Act on the handout, and it is an attorney in the Birmingham area with a large firm in Birmingham, Catherine Barr, and she's done special needs law for decades and is very knowledgeable about the Special Needs Trust. Moving away from funding and funding into adulthood for a second, I'm going to talk about just some of the issues that come up in transition. You know, within the public health arena, some of these touch on things that public health might be approached about regarding adults living with autism. So I just want to sort of mention the list of issues or challenges that an adult with autism can come in contact with, just to kind of highlight those for you and make you aware of them. And that way, if folks do come in and say, you know, we have a adult family member with autism, we're having these difficulties, we don't know where to go, you know, you can think about this presentation and think about some of the agencies that Anna mentioned, or for those families to contact Autism Society of Alabama and get headed in the right direction or get some supports in these areas. There's just so many areas where an adult with autism might have challenges, and it's things that we all may achieve, accomplish, move through, handle effectively in our day-to-day life. And for somebody with autism, it can be really, really, really challenging or difficult because of their social challenges, communication challenges, and their sensory challenges. Any one of these can be a real stumbling block and cause great difficulty. As we said throughout the presentation, there's more and more resources, there's more and more supports in the community, and hopefully for these individuals that are reaching adulthood, these will become easier and easier for folks as the next group of people with autism move into the community. So I'm going to go back to Department of Public Health and the interactions that might be specific to Department of Public Health. I mentioned the Autism ID card. For every county health department, during the break we were talking, most county health departments are identifying, you know, kind of one contact person or sort of a contact team for the Autism ID card. I think that's a great idea. I think to have one person on site in every county health department to interact with families that are coming in with a member with autism is a fantastic idea. Kind of have a point person for the team that's local, and I think that's absolutely brilliant. The emergency preparedness training that we do at Autism Society and our first responder trainings and some of the interactions that we have on a state level and a national level with helping families become more emergency prepared, that's an area where also public health can come into play. So in any county, I know that many county public health departments work with families on emergency preparedness. There are some specific caveats that are very helpful for families with autism, and we can pass those along to you, or there's lots of information online. The one that always jumps out for me is making sure that individual with autism, somehow they're tagged, they're labeled with their information, with a contact phone number. I know for my son, we just always, even though he's 16 years old and can functionally communicate, if he was under some kind of distressing situation, like you know, a tornado or some other terrible weather event, you know, I always have a T-shirt available that actually has his information written in Sharpie in the T-shirt in case the rest of us were incapacitated and he was found alone or separated from us somehow. Things like that. Having their desired items in your emergency prepared kit just in case you need those. Some things that are specific to autism or specific to disabilities that can then be added to the type of emergency preparedness that any family might do. In addition, the making public health employees aware of the Alabama Interagency Autism Coordinating Council that Anna leads, and just to know that there is a state council in our state. Another thing that's really neat about Alabama, I try to highlight the neat things we do in autism in Alabama. One of them is the Autism ID card, and the other thing is that we have an autism coordinator. So we have a state position specific to autism, which is just remarkable, and there's only a handful of states that have that, which is just great. Back to the Autism ID card that we already mentioned, and we know that it's getting more and more popular and more families are interested in getting the card. Anna and I looked into, you know, kind of what do services look like in other states compared to the state of Alabama, and we were sort of batting that around this week. You know, how does that in particular, interact or have an effect on people that might be working in public health. And I guess the real message there is that we've got some pretty specific things going on in Alabama related to our ruralness and related to our resources, related to, you know, just the level of low-income families or families that might be living in poverty. So not unlike other things that that folks that work with public health come in contact with, you know, autism is pretty similar. Specific to autism, insurance doesn't cover autism adequately, which is just very unfortunate. So for a family affected by autism, they're typically paying for therapies out of pocket, and that, of course, can get very, very, very expensive very, very quickly. So for families living with autism, the lack of insurance coverage is a really big issue and a really big problem, and hopefully that will be rectified over time. In addition, related to the insurance issue, a lot of professionals who work with kids and adults with autism may not choose to stay in Alabama or practice in Alabama because our insurance doesn't cover autism. So it's a real problem that we have keeping enough service providers, enough therapists in Alabama because they have a hard time making a living because of the lack of insurance payments for speech therapy, occupational therapy, and applied behavior analysis or behavior therapy. Related to what Anna was talking about earlier, our waiting lists for state services often can be quite long, and that also can be a real hardship for Alabama families. So just some things that, not unlike other parts of public health, those parts very much affect the autism community too. Hopefully they will continue to improve. A recap of where do folks get services as they go through childhood and moving into an adulthood. As Anna mentioned, very early on, early intervention is available in every district or every county in the state of Alabama. And then the child will move into the local school district at age 3. Schools are mandated by federal law to provide services for an individual with autism or developmental delay starting at age 3. It might be preschool services, it might be speech, it might be occupational therapy, it could be behavior therapy, and then that continues throughout the education years until age 21. A child with an IEP qualifies for school services until age 21. So my son, who is 16, will not leave his Alabama school system until he's 21 years old, and he'll continue to receive services there to help him transition into adulthood. After the education years, an individual transitions into adulthood at late high school and then moves on into Department of Rehabilitation Services and vocational rehab after that point. So I have a slide as I'm wrapping up of our contact information as we had at the beginning, and both Anna and I are super easy to get in touch with. We're easy to find, we're easy to ask questions. So if something comes up after this presentation, please track us down. I know that because of my frequencies of numbers, because of my statistic, which I know you all appreciate statistics, my statistic says that 1 in 68 individuals that I'm speaking to is living with a child with autism or a loved one with autism or maybe an adult with autism. So as I wrap up, I just wanted to mention that right now in the state legislature, we have a Senate bill that would mandate private insurance to cover autism therapies. 43 states have passed a similar law. Alabama, obviously, has not, but it is a bill that we have in the legislature right now that we are hoping very much will be successful. Specific to public health in general, In the 43 states where a law has been put into place so that private insurance covers autism therapy, Medicaid typically follows and will cover autism therapies after those laws have been put into place. So specific to anybody watching this, if our law is successful, if our bill is successful, which would be wonderful for autism families in Alabama, then after that, Medicaid might be more set up or ready to cover autism therapies through Medicaid funding also. So something we have going on right now that's kind of exciting, and anybody that is particularly interested in that bill or that legislation, it's easy to follow the way that that's going through the legislature through our website of Autism Society of Alabama that is on the slide. And I will turn it back over to Anna.
Great. Thank you, Bama. And also, I wanted to thank, on behalf of the Autism Council, I had mentioned our Accessibility Committee. They had put together the slides that we had gone through about all the state agencies and their contact information and what's available. So Brooke Bowles from Triumph Services in Birmingham and Joe Carter from Glenwood put those slides together and let us use them today. So we're very grateful for what they've shared, and that presentation is also available. They have offered to speak, to share their presentation, so please keep that in mind. Contact me if you're interested in any of that information being shared. As far as the Autism Coordinating Council, I've mentioned that it's a larger group of stakeholders, and we have a number of committees. Our meetings are all open to the public, and if you're interested in being on a committee, you're very welcome to participate. I just wanted to let you know some of what we are working towards. There's, as we've talked about today, a lot of issues related to autism that need to be addressed. And so this is kind of scratching the surface and hitting the highlights of the bigger issues that we're working towards. Our first goal that we work towards, our committees are centered around each goal, so we have 5 total, about accountability, and that's really promoting the evidence-based, high quality, and they're also cost effective. So when you talk about models that are really making a difference for individuals with autism, they usually work for lots of other kids too. And they're pretty simple, but it's just being able to know how to do it effectively and to have the right experience and education to provide those services effectively. So their Accountability Committee has been looking into what are the most evidence-based treatments, and there's a few things. If you have questions about what treatments are available, the National Autism Standards are available, and they are in phase 2, and they did a good meta-analysis of lots of journal articles and research to say what treatments are most effective for what ages. So I would recommend looking at that. It's the National Standards Report by the National Autism Center. And they do a number of other things looking at different documentation, but that has been a good point of reference, as a good starting point. Our second goal in committee is public awareness, and Autism Society of Alabama really does have a lot of input into this committee, and they are just raising public awareness of what issues impact families. So a lot of what Bama spoke about today that Autism Society is doing with their first responder training. There's a lot of Autism Friendly. She had mentioned Regions Bank was doing some activities. There's going out to baseball games, conferences, family camps, lots of activities that circle around public awareness and getting the community involved with individuals with autism. There's also a really exciting partnership that's gone with Help Me Grow, is a Birth to 8 program that's been in Alabama as a pilot, and now it's just expanded statewide. And they're working with 211 call centers. So I think they've all been hired now, so it really is a new program. There's a statewide Help Me Grow director named Katie Naiman, who we partner with a lot. And you can probably Google Help Me Grow Alabama for their contact information. But in the Tuscaloosa area, we had put together a lot of information about autism for pediatricians, and they had provided some training and this information for about 14 different pediatricians in the Tuscaloosa community, and we're looking to do that partnership again. But if you're a family with a child and you suspect they have a developmental disability, anything that's needed for early childhood, you can call 211 and be connected with a Help Me Grow coordinator. But the beauty of 211 is that it's also a statewide number for if you need help with electricity. If you are looking for anything, that is the call center for that. But also now, if there's developmental concerns, you have someone to talk to at that same number. So please keep that in mind, 211 statewide. Our partnership with them will be growing. They're still developing, but that's definitely something to be aware of when you're looking for any kind of service for a family. Our next goal about funding has been one of our primary focus for this year. As Bama said, we've been talking about insurance reform, the need for insurance coverage, the need for service providers because they leave based on that insurance coverage, and then also the need for coverage within Medicaid included in that insurance piece. So there's a lot going on with funding, and that really has taken up most of our energy and activity because it's what the rest of services are based around. If you're not getting basic needs met, then the rest won't be able to fall into place as easily. So this really is important. Another thing I'll talk about at the end are regional autism centers, and so we're working on funding for those as well, and I'll tell you more about that in just a moment. The Accessibility Committee is chaired by Brooke Bowles. She's the one, she and Joe Carter had created the center part of our presentation about state agencies, but they are looking for increased choice and access to quality providers. So if there's not as many service providers, there's not as many to choose from, and making sure that they really do have the qualifications and the experience to provide more than adequate training to provide excellent services to families. And so really making sure that we've identified those individuals, that they're connected to families. And so part of that was training someone at Voc Rehab, and then also training the network group leaders. So Autism Society has 30 or so networking groups around the state. And so those are parent-led, making sure those parents are aware of how to look for a high-quality service provider, one who has training and experience. And so that is part of it, but also trying to make sure that we have capacity in Alabama. In public health, we talk a lot about capacity, making sure that there's a number of providers. And so that is what this group really works towards, and working within the current infrastructure, making sure that we can add to what's already there rather than creating a whole new system of care. It's finding what works in other agencies, how to incorporate autism and the needs that people have, those services within the current system of care. And that's really what the Autism Council is charged with doing. And one of the pivotal pieces to doing this is our final goal, Goal 5, for regional networks. So we're working on regional autism centers. We had legislation passed in 2009 that allowed for the creation and development of regional autism centers in 4 to 6 different locations around the state that are university-based. And so the only caveat to that was that funding would need to be allowed for in a line item with the legislature. And so we're still waiting on that. We're hoping to get at least some of those centers funded this year with some minimal funding, but just to get it started. We're working with, here we go, with 5 different universities. The universities we've identified are University of South Alabama, Auburn, Alabama, UAB, and University of Alabama in Huntsville. There's already some kind of existing autism program in each of those universities, and there's a larger one, so that's why they were chosen by the council. But also the goal is once these centers are built up, they would partner with some of the smaller colleges within their region. And this map hopefully looks familiar to you. It's based on the RCO regions, the regional care organizations. So if you're working with an RCO, please know that hopefully these regional autism centers are coming and would be a great resource for getting information to families. And this is part of the legislation. It's important to know what the regional centers would offer. It's not a place necessarily where you would go and get a diagnosis and all your therapies, although that can and probably will occur coinciding with the regional center. But the purpose of the center is more of an education base. It's that capacity building. So first you need a staff that has expertise in autism and related disabilities. The next activity of the Regional Autism Center would be individual and direct family assistance in the home, community, and school. So that means they would work with families over the phone, go meet with them in the communities if they needed help in schools. It really is built to mold to the needs of the individual. These regional autism centers are based on the CARD model in Florida, Center for Autism and Related Disabilities, and they have a very robust program. And so know that when these get started, we're still going to have a long ways to go, but this is where, this is the basic outline of a regional autism center. They would also provide technical assistance and consultation services. So if you think about a school system having trouble with finding the right behavior plan for an individual with autism or multiple individuals with autism, or finding the right curriculum that fits the needs of students, this would be a great way for someone to come in and help a school. Give them some resources. The Department of Education already has an autism initiative where they can come in, help do crisis management, some behavior training, behavior plans, but this would take it a step further. We hope to work with some of the in-service centers with Department of Education, so there's a lot of ways that this could be expanded and really helpful. One of the primary jobs of this center would be professional training programs. So that's building the capacity, making sure people are coming in. And also, it's perfect. There's students coming through. So you are training, and they would have the opportunity to work with individuals with autism before they even got into the field. How much of a step ahead they would have if they had already had some of the experience. And then finally, it would be public education programs. So making sure, like what Autism Society is doing with their public awareness group, that the community knows about autism. They know how to interact. They understand more of what challenges are going on and what strengths there are, to be able to make sure that it really is a community where everyone is involved and everyone's appreciated. And the regional center, I know it has center in the name, but the idea is not to have a center-based concept, that it really would be about community, that would be your home base, but that things would move outside of that. This is a rural state. It's not going to make sense to have everything housed in universities and the most populated areas. And so this really is about partnership and expanding. Each of these universities has been doing assessments this past year, and will be wrapping up in April. And what they're doing is making connections with every service provider they can find in their area. And so hopefully, if you work in an RCO, County Health Department, someone has been contacted by the center. If not, they've been able to find your information, but just to be able to build relationships, find information about where children, adults, anyone is getting services, to make sure that whether it's DHR, county health departments, first class pre-K, everything that's out there, there's a list so that individuals with autism can be directed to appropriate services, and that the services who need some support providing information to families will be able to do that, and there'll be a relationship there. And that's also hoping to make productive use of our time until we have funding for at least 2 to 3 of these centers. So that's our goal. Were you this part, Bama? Okay. But for what can you do to help, our main message is to refer. So if you have a question, if there's any question about if autism is there, we tell pediatricians, and it's the same for every other professional, go for a diagnostic assessment. But the wait can be as long as a year. So be aware that there are extremely long wait times for most services. So in the meantime, refer somewhere else. For assessments, there's a long wait time, but for services, you can usually get in fairly quickly. So you don't, for most services, you don't have to have a diagnosis to get your speech. Behavior therapy, you can see the delays and they can do their own assessments. You don't have to have the label quite yet. So just know if it's a pediatrician, a nurse, a social worker, you can dual refer. Make sure it's for interventions and for diagnostics, to make sure that those interventions are really targeting what needs to be there. We don't want families to wait any longer than they have to. So that's really making sure. That's why we made sure you had all of the information for available services there.
So, and that the schools are dealing with autism so much now, they really can be just a fantastic resource of information.
Right.
So if, if a parent, is in a particular area, if that child is under 3, call early intervention and go ahead and say, I'd like some help, even if you don't have a diagnosis.
Yes.
And then if the child is 3 and over, you can go ahead and call the school district and say, how do you guys handle your students with delays, because I think my child has a delay. And then the school system can often navigate the parent, through the local system, whatever that may be.
And they have their own eligibility, so you don't have to necessarily have the diagnosis because they have their own eligibility assessments that they do.
And they can get on with it,
Yep.
while the family's waiting for a thorough assessment. And we were going to stop at this point, it looks like about 17 till or so, and see if any questions had come in. And if there aren't, then we will fill the minutes needed so that the CEO requirement is taken care of. But we were going to stop and see if anybody in the room had a question, or if there was any question that was sent in from elsewhere.
I think we do have a question.
Yes, we do. I've seen a lot recently about cannabis oil being used as treatment for various conditions. Your thoughts on its use for people with autism?
Right. I think it's just going to be a wonderful addition. And I've talked to folks in other states that already have access to medical marijuana, or where marijuana may be legal. And across the board for autism, it appears that it could be very helpful for the vast majority of individuals. So most of the people I've gotten feedback from personally have talked about the use with adults. So I have not talked to as many people that have used it with children. I've talked to folks that have used CBD oil with children with seizures, and it appears to be incredibly helpful and successful for most of those folks who suffer from seizures. But back to marijuana, I'll start there and then I'll go back to the CBD oil in particular. But I have only minimally led the research on why it is helpful, but it appears with decreasing anxiety in the moment for those adults with autism, a huge component of autism for the vast majority of people who suffer from autism is just debilitating anxiety. And it sort of makes sense. If you kind of have all the challenges that we talked about today, you can understand how really complex and complicated the world could seem most all of the time. So I know I can speak from my personal experience with my 16-year-old. He is just kind of riveted with fear on most any day. I've always described him as one of the bravest people I know, because I know how very much he worries about every sort of moment of his life, and yet he gets up and he goes and he tackles the day as able looking as, many typical kids that I've been around. So I'm just amazed with the level of anxiety that they live with. But my guess is for those folks, if they could decrease that anxiety even for a few minutes of their day or at the end of their day, it's going to be a very blessed and welcome thing. That is surely just my opinion as an autism parent, and I surely have no direct experience with it. CBD oil, the person who does our first responder trainings, coincidentally, is Dustin Chandler, who pioneered CBD oil legislation in the state of Alabama and was behind getting the law passed to allow CBD oil to be used for seizure disorder. So we are both with Dustin a great deal and around him a lot, because he happens to be a first responder who knows a lot about special needs. And so he's the first responder trainer that we work with in Alabama in the autism community. And he has just remarkable stories on how successful it's been with seizure disorder. So my guess is that we're just at the beginning of the use of CBD oil for medical purposes, and that our community just happens to be one of the first ones where folks are looking. But I say bring on the research. If there's anything that could help with that level of anxiety, I surely wish folks would look into it. I just took that question, so if you have anything to add.
The only other thing that I was thinking about too is the number and the power of the medications that individuals with autism tend to be on is incredible. And so with some of the families that I've talked to, again, personal connections, they were able to not be on as strong and as many medications because of that. So I think more research, like Bama said, more research definitely needs to be done, but also more research into medications and its effects with individuals with autism, because some things are meant for other disorders, but used for autism too, because there's not something that is a perfect fit.
There's no great med for autism.
Right. And so trying to find something, I think there's a balance in all of that. And so research is needed for all of it. There's a lot of side effects that come with the amount of medication and the type of medication that kids with autism and adults with autism are on. So that could be another tool that's used.
I've heard that too. And any other questions? Or
Oh,
was
yes. In reference to young adults, what kind of specialty housing is available? And if you're looking for specialty housing, what should you look for those with autism?
You can date.
So for young adults in Alabama, there are different programs that can assist with independent living, but there are few and far between. So I know Triumph Services offers some. You can also have some services available through waivers. However, you have to have an intellectual disability to qualify for those waivers, or that you would have another co-occurring condition that you would qualify for some mental illness services or some others. So it depends where you live. That's, I think, a big message for Alabama is especially for services for adults and for young adults, it's hard to find. In the Birmingham area, Triumph Services is a nationally recognized model that's been successful, and they can help with some independent living skills. That's one of the qualifications for their program is working towards. You don't have to be living independently, but with that as a goal. So that's my response. Bama, did you have?
I would say the same thing. Triumph is such a great program, and it's a small program in the Birmingham area, but they're trying to expand. It's a program to help folks with independent living, recreation, and live, work, play.
And
so,
employment.
Employment. Anyway, I think it's a great model and really works on, what can we do in any particular community to help these folks live independently. As far as residential care is a real problem in Alabama, and I am concerned that it's going to become an even bigger problem before it gets better, just because of the sheer number of folks being diagnosed with autism. There's very few residential centers like Glenwood in Birmingham or Learning Tree in Mobile in South Alabama. There are very few residential centers for kids and adults with autism, and the waiting list can be quite long to get one of those placements, and that is a real problem.
My friend is concerned about her 18-month-old. What are the most common signs of autism at this age?
And so I'll just read straight from the Autism Society of Alabama brochure. For parents of a young child, those warning signs of autism can be found so readily online because of just as I keep saying, the sheer number of folks affected by autism are concerned about autism. But what you want to look for is the language development, the social development, so the eye contact, babbling, starting to use, put words together, and those early signs of kind of social reciprocity and communication. I am going to turn it to Anna because her little boy is just a little bit older. So.
Yeah, and especially he's in a child care setting, and so looking at the other kids around, you can always ask, especially if they're in a child care setting, ask the teachers, ask other people who are around kids a lot. For me, this was my first child, my first and only right now, and so I always, even coming from the autism field and public health and development, I still found myself asking questions, but I feel like you would you would definitely know. There have been studies that shown parents had first concerns months to years before there was ever an assessment or a diagnosis or even a referral in some cases. And so if you're a parent and you're concerned, check it out. And if you're still concerned, keep pushing to make sure that they will get an assessment. So you can self-refer to early intervention. Remember that you can self-refer to services. So if you're having concerns, service providers often can help you identify some of those things too. And it doesn't, especially at 18 months, you'd qualify for early intervention, at least for an assessment if you had a concern. So that's what my recommendation would be. But it's the eye contact, it's language development, how it's used. You'd usually know pretty soon that something was going on. And parents are the best ones to know. They're the expert in their child. They know their family and they know their child.
And there's some great checklists online.
Yeah. So if you're really concerned, you need to compare Autism Society.
Autism Speaks. We have
CDC
one.
has a great one too.
CDC has a good one.
Yeah, cdc.gov/autism. They have lots of resources there and early warning signs. They have a whole program called Learn the Signs, Act Early that we've participated in. And so that's about development. It's general development, but really focused on autism, but they don't use that word as much because it's really looking at development across the life, across that age and all facets of it.
Are there any genetic or environmental factors that make it more likely for a child to have autism?
Yes, and we just don't know what they are. So, yeah, the autism seems to be genetic and environment, coming together and playing a role. So, great example, identical twins, one's diagnosed, one isn't. With the same genetics, and obviously there was some environmental interplay. So it seems, not unlike other, I think the theories behind a lot of childhood disorders or illnesses are kind of similar, with diabetes, asthma, juvenile arthritis. I think that it's probably going to be a similar theory of there seems to be some genetic predisposition and then some environmental impact, and it's probably going to be a long time before we know exactly what those two are.
There are studies going into it, though. In South Alabama, they're partnering with University of Texas, I believe, and looking at environmental factors. So they're in the process of recruiting families for that.
So you can have, two kids with the exact same environment and same. There is, gender parts. I mean, if a family has a boy and a girl, like my family had a boy and a girl, and there's more likelihood that a boy is going to be affected rather than a girl in a family. But yeah, if you have two boys in a family with the exact same environment, or almost the same environment, one can be affected and one not.
And the
twins,
rates are
one can be
higher
affected or not.
within families. The rates are higher if one sibling has it. There is an increased risk that another sibling would be impacted by autism. So we don't know yet is the answer.
And that's it at the moment.
Okay. Is there any parting thoughts you may have?
No, thank you for having us. And like I said earlier, we are so available. So folks can track us down after this presentation if there's any follow-up questions or issues or concerns. Yeah, please email or call either one of us.
Yep. And later in your slides, I think the next slide or two, it has both of our contact information. So please.
I'll go to the contact.
There you go. So feel free to get in touch with either one of us if you have more questions, or just even if there's a family that comes and says, I need help, give us a call. That's what we're here for, and we enjoy working with families and helping to connect them to their needs and some resources. So we appreciate everyone's time today.
And thank you both for joining us and sharing this information with us. The program today will be available on demand within the next couple of days. So if there's something that you want to watch again, or if perhaps you want to share it with others, it will be available in about 48 hours. Thank you for joining us today on the Alabama Public Health Training Network.